Hello and welcome to Box Hill Institute's information session. This information session is on Certificate 3 in Allied Health Assistance Partial Completion for VET delivered to secondary school students. My name is Lachlan. I'm one of the trainers within the Certificate 3 Allied Health Assistance program. I'm going to take you through today's session. Before we begin this, I'm going to give a brief acknowledgement to country. Box Hill Institute acknowledges that all of our learning sites are situated on the ancestral lands of the Wurundjeri people of the Kulin Nation. We pay our respects to the traditional custodians and extend that respect to their elders past, present and emerging. So this program, as I said, is around our Certificate 3 in Allied Health Assistance, partial completion. And it's sort of centered around becoming a healthcare or an aged care worker at Box Hill Institute, or obviously looking at that potential pathway into your future. And the benefit of this sort of program is you actually get to practice working that sort of capacity. You get to practice, obviously, before doing further study to actually work in that industry to see if you eventually like it or if you like to do further study in that particular area. Just as a brief introduction to, I guess, what we call it, what the program is actually titled, Allied Health Assistance. So the overall program will teach you the skills and knowledge required to provide assistance to health professionals involved in the care of clients, and it also involves direct client contact under supervision. Within this program, across 2 years, you will also develop a range of knowledge and practical skills that relate to infection prevention and control, workplace health and safety, client movement, cultural diversity, workplace organisation and communication. So it's a very, very diverse program where you learn a lot of skills. So even if your interest may not necessarily lie in the healthcare space after the 2 years, you'll have lots of skills that can be put into practice in any particular industry that you might decide to go into. So industry and pathway opportunities. So following the 2 years, there's many different pathways you can obviously take in healthcare. We've just listed just a few here. So if you were interested in doing further study, you can obviously complete some programs with here at Box Hill. So we've got Certificate 4 in Allied Health Assistance, so a continuation of the Cert 3. We have got our Certificate 3 in Health Service Assistance. So that's working within the hospitals, working with the nursing staff. You might be employed as a orderly, as they're commonly known, or you could work within the kitchen or all the other aspects of the hospital as well. Certificate 3 in individual support. So working primarily within the aged care industry, working in nursing homes or aged care facilities, working with elder clients, providing care in those sort of spaces. And obviously we have our pathway or our diploma of nursing as well, as a further study option with Box Hill as well. Some employment opportunities, again, as I mentioned, a few of these, but you could work as a patient care assistant, health service assistant, ward assistant, allied health assistant. So as I said before, working with other healthcare staff, and obviously with further study, you can obviously work in many different areas as well. But there are lots of different options for a role in healthcare, either as a permanent ongoing role or something that you might do while studying further as well. Our facilities at Box Hill, we have very, very good facilities. So we have sort of cutting edge healthcare facilities at both of our Box Hill and Allendale campuses. They're well equipped. We have high-tech simulation facilities. So our facilities are very, very replicable of the real world. So what you see and where we train you and where you have your education in the practical space is very, 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 very similar to the real world as far as all the equipment we use, the setup, the processes, the tasks, they'd be the same in the classroom as you would put into place within a real world or within a job scenario. So we have these simulation spaces, advanced medical equipment to deliver our practical, theoretical, and skill development education sessions. So we do practical-based learning, we do obviously some theory, and we also do hands-on learning as well. So quite a variety across the program. Healthcare students, we learn in real-life simulated patient scenarios. So we're providing, again, real-based environments. We're working with, situation-based or real-life simulated patient scenarios to be able to put those skills into practice in a scenario replicable of the real world. Some of our equipment that I've sort of put down, as I sort of said, our simulated hospital ward, but we do also have patient transport equipment, including wheelchairs, hospital beds, trolleys, and a lot of other equipment as well, obviously cleaning supplies, PPE, and other equipment as required within our different units. So what's expected of you? Being a student in this program, Certificate 3, Allied Health Assistant, if you're interested in this program, learners should have an interest in their future career within the health community services setting. You might not necessarily know what you want to do or where you want to go, but having an interest potentially in a career in health community services is a really, I guess, important thing to have, because a lot of our learning is obviously tailored towards that. And what we're educating you and training you is for that potential career. Having an interest will leave you in good stead to build your skills and maintain interest and enjoyment within the program. Our learners should also have a willingness to learn and to be involved within the theory and practical classes to enhance their learning. We try to be as hands-on as we possibly can. So being more involved, wanting to be more involved, being invested in that learning, you'll really be able to take out a lot out of the training program that we do provide here. Learners should also possess these sort of personal attributes, including good communication skills. You're able and willing to follow instruction, good organisation skills, and the ability to show empathy for others, which is quite an important trait for people working in the healthcare and community services industry. These are the units that we deliver within our Year 1 and our Year 2 program on the next slide. They may not mean too much to you at the moment, but basically in Year 1 we do 7 what we call units of competency, or 7 different units, and they make up a combination of some more theory-based units. So for example, communication, organising work priorities, maintaining a high standard of client service, and we've got some more hands-on or more practical-based units, including obviously infection prevention and control, workplace health and safety, assisting with movement. So we try and balance out our program with a combination of our theory and our practical-based learning. Within our Year 2 program, again, we've got a combination of our theory and our practical units. So we've got, in medical terminology, looking at healthy body systems, transporting patients with our transport equipment that I mentioned previously, and also engaging with health professionals in the healthcare system. So getting a bit more understanding of how the healthcare system actually works and the different people that are involved in that particular systems. How our program integrates with VCE and VCE-VM. So on successful completion of the program across the 2 years, you have recognition of 1 unit at units 1 and 2 level, and a minimum of 3 units at unit 3 and 4 level. Students who complete or receive a 3 full unit sequence may be eligible for increment towards their ATAR. So 10% of a 4 study score in the primary or 4 scaled studies. With the ATAR, students wishing to receive an ATAR contribution for the units 3 and 4 sequence of VCE Vet Health must undertake scored assessment for the purpose of achieving a study score. And this study score can contribute directly to ATAR, either as one of the students' best 4 or their 5th and 6th study. The way we teach the same. It's just that the exam component is for those who are wishing to receive a scored VCE and going down that route. If not, that's more than okay. That's obviously facilitated through your school. And because that incremental is awarded by Victorian Tertiary Admissions Centre, or VTAC. And that brings us to the end today. I thank you for your time and your viewing. If you do have any questions or want further information, please reach out to our contact information, which you'll find on this page. And then the team will be able to get back to you with any specific questions. Thank you for listening. Thank you for attending our viewing. And I wish you all the best with your future studies. Thank you so much.